Hi, everyone, and welcome. Today, we are joined by Christy, who's here to share with us her experience at Override and her pain journey, her story, how things have changed for her along the way. And we're so grateful to have you here, Christy. Thank you for taking the time to talk with us.
Happy to be here.
So I wanted to start with allowing you to introduce yourself and sort of laying out the picture of where you were before you came to Override and what your pain looked like then.
Okay. I've had chronic pain since 2011, and I tried several different options, got a lot of different opinions on what was causing the pain. It was on both sides of my hips, my buttocks, and down the back of my thighs was the predominant pain at that time. And they said, oh, it's on both sides. It's got to be your spine. So after a year, I finally gave in and had a back surgery, which ended up making a second back surgery necessary. And I had way more pain. Then I had pain in my back after that. And I was on pain management. I had started that even before the back surgeries, but I was on opioids for 13 years. And a lot of that time I looked for someone that was, I kept telling my doctor, I just need someone to talk to understand how to live with chronic pain. My life has changed so much, and there's so many things I can't do anymore. And, the disappointment of what I was looking forward to being a grandmother. And, I was already a grandmother, but, being able to do those things. And it just, we couldn't find anybody. And the people I talked to, they just didn't get it. They would say, oh, you're overly depressed. You need to be inpatient. They just didn't understand the things that go with chronic pain. And so finally, my pain management, what was this? About a year and a half ago, said, oh, yeah, I went to a conference and I got this pamphlet. I was thinking about you. And so that's how I found Override. And the pain coaching was the big draw for me. And thinking, oh, somebody, if they really have pain coaching, maybe this is somebody that can get it. And I was hooked from the very first call.
I love to hear more, Christy, about, what sort of things were you not able to do before you came to Override that you really wanted to accomplish by coming here?
Well, having chronic pain affects your mood tremendously. And just, wanting to be able to bake cookies with my grandkids or get on the floor and do Legos, and was not able to do any of that. I had, just shrunk my world down to never leaving my house, getting my groceries delivered. I couldn't even go to the grocery store and push that buggy and make it through long enough to get through checkout. And I would get somewhere, and one of the things I didn't expect really from chronic pain was I personally had a lot of trouble with getting overwhelmed if there was a lot of noise or a lot of sound. And so I just, quit going to anything anybody invited me to. And I just finally quit even accepting invitations, because when the day would come, I would get panicked and get anxiety and go, what if I get there and I'll be embarrassed? And I didn't want to draw attention to myself, and don't want everybody to feel sorry for you. And plus, you don't want everybody to know what you're going through. And when you have chronic pain and for that long period of time, it's almost impossible for someone not to notice if they've known you for very long. So it was everything. I mean, I sat down, I started watching TV quite a bit, which I had never done before, and just for distraction, and just tried to do my best, what I could with the girls, and tried to be very conscious of, not getting snippy with them. But it was a chore. I mean, I succeeded because I didn't want to take it out, have them feel any of the repercussions, but it was hard and it was exhausting.
Yeah, I think so many others would be able to empathize with your story and also recognize similar themes, feeling like pain takes over your entire life and your mood, it sounds like. And that is a very common experience amongst chronic pain patients. So You came to Override and you've worked with us for quite a while now. What has really stood out to you about the care that you've received here compared to all the other things that you've tried over the years?
Well, as I said before, the pain coaching was the big, oh my gosh, this is too good to be true. When I was reading through Override's webpage. And then every person on my care team had experienced chronic pain, if not still experiencing it. Everybody, they get it. They understood when I say, I don't know how else to explain it, but this, and they were like, I get it. I totally know what you're talking about. And I think that was the big surprise was that, and even the physical therapist I had, the first one that I had was a younger girl. And I don't know if she had chronic pain, but after a couple of sessions, I didn't feel like we clicked, and I was able to reach out, and they quickly switched me to someone else with no problem, because that was the other thing. Override understands that not everybody's going to click with everybody else. And I appreciated that they were very willing to put me, to try me with someone else. And the second physical therapist that I got was amazing. And I loved that I had been through physical therapy, I don't know how many times. I literally, somewhere between 5 and 10 times probably. I'd never had a therapist that was understanding, because he had chronic pain. And he would never push me and say, oh, well, you need to do this to get better. Never said anything like that. He said, if it hurts, you tell me, we stop. We're not trying. You should not feel worse after this than when we began. And that was such a relief. And then so many of the exercises or things that he had me do were normal, everyday things. So it's not like I had to set aside 30 minutes to go through my exercises and felt like a chore. Never. One of the things was apple, like you're picking an apple or drawing your sword. And I won't go through those motions, but they mimic motions of emptying your dishwasher, putting your dishes up, picking up things, even taking a shower. And he taught me how to make that movement a full body movement, to where I was doing my physical therapy, just living life, not having, to really focus on it.
I think that it's wonderful to hear your experience with a real chronic pain trained physical therapist, because we know that's really different experience than just a physical therapist who focuses on more, post-operative or acute pain issues. And so that's a really key part of your team there. Was there ever a moment over your time here where you felt like things were like, was there a clicking moment when everything shifted suddenly for you, or was it more gradual?
So many. I'm serious, because again, my physical therapist recommended, he said, if you're in a situation that you can't get out of, that you have to endure, and your body is telling you, I'm in pain, trying to warn you, so to speak, talk to your body in your mind and say, I hear you. I understand. We will address this later, but right now I have to get through this. And it sounded so ridiculous. I'm like, how's that going to help if I'm just saying something in my mind? But it worked. It really worked. And then he said, and be sure when you get home, get by yourself and just the kind of the meditation and let your body talk to you. And that was a big aha moment, because I thought it was, it was an eye roll. Oh my gosh, I'm going to look silly. But it absolutely worked. So there were so many aha moments. I've been through several clinical trials that we did meditation, similar things to what Override did, but it was never targeted to me understanding how my body's working and how this chronic pain gets chronic. And my doctors are saying, well, we can't really find anything. And they diagnose you with things by process of elimination. I was just never comfortable with that. And once that I listened to that and was able to do further research on my own, that was a big moment too. And that was early on. That was very early on. So there's just too many to name. And when I got into pain group instead of one-on-one, there were so many things the other people in the group shared that you're like, oh my gosh, I'm going to try that. Or, it might just be an essential oil, or it was not medical advice, but just ways that they cope. And lots of aha moments in pain group too.
That's beautiful. So I'd love to fast forward to today, and you've been through the program and you've gone through group, and you've had good experiences with your team. Uh, what feels different now for you compared to when you first started with us?
As ridiculous as it sounds, I can honestly say everything. Everything about my life is different than it was 15 months ago. I am not depressed. I have zero depression. I have bold confidence to handle any situation. I've had some acute pain situations that I've been able to apply the override techniques to as well. And one being kidney stones. So if anybody hears this that had kidney stones, you know how painful that is. It got me through that. And I don't have fear. I'm not fearful. And I really didn't think I was a fearful person before I joined this program, but I little by little over the years had just gotten, that's what it was all based in, fear. Fear, am I going to be able to do that? Fear, am I going to, be embarrassed? And none of that now. I feel much more comfortable telling people, that I still can't stand in one place for long periods of time. And used to, I'd be so embarrassed I wouldn't say anything, but now I just say, I'm just getting a little uncomfortable. Can we sit down? And no one looks at you still. I mean, some of the stuff you just get in your head about that other people are thinking, that's probably not true. But again, it's part of the mental part of chronic pain. I have none of that now. I go on walks and help the girls ride their bikes and their hoverboards. And, I know how to listen to my body and say, okay, today's not the day that we're going to go out and play soccer in the backyard. But, I can get on the floor and do Legos. And I just have learned to listen to my body and to take, that couple of minutes to kind of recenter myself and just, again, listen to my body, what's going on, and not push myself. The hardest thing in this program for me was pacing, because you get into such a habit of, when you have a good day, you just try to cram everything you can in because you've not been able to do it, whether it's house cleaning, errands, whatever. And then you pay for it for days afterwards sometimes. And that pacing has made all the difference in the world as well, because I've been able to retrain myself that it's okay if I start doing the dishes and I have to go sit down for a little bit. Big deal. Used to it, I'd be so frustrated with that and angry at myself or my body, and shame even, which is ridiculous when you think about it, but still shameful that my house didn't look as clean as I wanted it to. And the pacing was a big thing too. So I didn't mention that when there's an aha moment, because that one took me far, far longer than any aha. Probably the whole length I was in the program. And but it has paid off exponentially.
Amazing. I'm so glad. It's so wonderful and inspiring to hear the things that you've been able to accomplish in a fairly short amount of time compared to the length of time that you've had pain.
Absolutely.
Yeah.
I've not gotten any of the things. I mean, some of them, like I was in some clinical trials for meditation, and some of the things kind of hit some of the high points maybe that override teaches you, but not in the depth. And I just think I love the progression of the program. So it starts out very simple, the fight or flight, explaining that starts out very simple and it builds on that. And I think that is so valuable to, stick with it and stick through it, because it all comes together. But I do want to say too, that I did wean myself off opioids, and my doctor did help me some. I didn't do it the way they wanted to. They hand those things out, but there's no way to get you off of them unless you go into a drug and alcohol treatment center. And I was just determined to try. That was the only thing I hadn't tried. This was before I found override, and a few months actually before I found override. And it was difficult, but that is the other plus of this program that I didn't even realize, was how much those opioids they were aging me. They were causing pain to be way worse. And which, when someone tells you that and you're in pain and that's your only respite, you think, oh my gosh, I can't stop taking my pain medication. But it does factor in so much. And I love that override just accepts you where you're at in your pain journey, no matter what. Wherever you're at in that journey, they can help you. And they're open and willing to do that. And I love that.
Amazing. So, of all the things, the amazing things that you've been able to accomplish in the last year or so, what's something that you're proud of or most proud of that's changed for you throughout this whole experience?
I would just have to say my ability to communicate with my body, I think, and being able to understand what my body's telling me and how my body works, from your vagus nerve all the way to, your nerve endings in your toes, and understanding there are different things. Like if I have, like most people with chronic pain, you have certain areas that are the worst, and I know what to do. If I'm having muscle spasms on the left side of my back, I know exactly which exercise to do. And 30 minutes later, I'm better. And sometimes, I'm not saying I don't ever put ice on or use a
Mhm.
heating pad. I still do that some, but nothing like before. And so I would say just being able to know myself better. And I really attribute that to everybody, including you on my care team, always made me feel so accepted, no matter what my opinion was, no matter what I was going through, no matter what mood I was in that day, no matter what I looked like on camera that day. I always felt accepted, and that opened the door for me to be able to accept myself and be willing to connect more with myself.
That is the greatest compliment that we could also receive, I think, as providers, to know that we've made you felt heard and accepted. Yeah.
Absolutely.
So looking back, Christy, what would you want others who are living with chronic pain to know, others who have not found a program like Override?
I think obviously join Override. That's the only thing I can say about that. But I think the especially if you have insurance, but even if you don't, the pain coaching program is not covered by insurance, but it was the best investment in, because that's what I needed. That was what I was really looking for. And then all of the other aspects, the psychology part of it, and the physical therapy, and, meeting with you, and the medications that, I was already on, and adding or changing, or, you were very open to suggestions I had. You were very open to my opinion of something maybe you suggested. Everyone was like that. And I think the biggest thing that I would say, being virtual, just in my own experience, people are saying, how do you do physical therapy virtually? And
Mm.
it works. Override has definitely got it down pat, and it works. I don't have to fight traffic. I don't have to sit in a waiting room. I know exactly when my provider is going to be on. I can be in my pajamas if I want to be, whatever. I don't have to get, made up or whatever to go out. And so I loved the virtual part of it. And there was never a time I didn't feel the connection like I would have maybe person to person. I didn't miss that at all in the virtual setting. And the other thing is, don't roll your eyes too much. Try it.
Yeah.
Because that was the thing that really helped me a lot, was just, okay, I'm going to try it. I'm just going to see if this works. And if nothing else, sometimes I just wanted to challenge it and go, there's no way this is going to work. And then it worked. And then I was like, oh my gosh, this is crazy. So that would be my other encouragement, is to be open to try anything that the providers suggest. Because, and again, they don't push things. It's not, if you don't like something or don't want to do something or it doesn't work for you, because everything doesn't work for everybody, then they move on to the next thing.
Mhm.
And I loved that too, that I had that freedom. I felt like I had a lot more control over my care than I had had at all. And I
Yeah.
had the best pain management doctor ever, and the best primary care doctor as well, who both of them supported me 100% in joining this program, and all throughout the program too.
Yeah, that's really nice to hear. So in closing, Christy, is there one word or phrase that sums up your experience here with Override?
One word is very hard. I have to give you more than, I'll do one word, but I have to give you more than one.
It's okay.
I would say fantastic, unbelievable, blessed, thankful, just awesome. I can't recommend it enough. And I've told so many people about you guys, and I just want the word to get out there, because who knows how different my life would have been had I known about, you guys were around 10 or 13 years ago, but nobody should have to suffer through chronic pain when Override's available.
Thank you so much, Christy. Thank you so much for sharing your story. And, we know it takes a lot of courage to come on and speak about your journey and share details. And you are an inspiration to many. And I hope that this video will even, expand that and share your story widely and help so many others who are dealing with chronic pain the way you were. Thank you, everybody, for joining us. Stay tuned for our next video.